Nightmare during the RLS attack, a person may feel uncomfortable, tingling, aching, or pain in their legs, usually while they are already resting, sitting, or sleeping. Dr. Mark Bookfer is here with more. And doctor, I'll tell you what, it's a problem that so many Americans are having. We understand that insomnia is becoming an increasingly bigger issue in this country with the potential of serious health consequences. What can we do about it?
Well, insomnia is a serious medical problem affecting millions of Americans, and it can cause fatigue, anxiety, and depression, and it increases the risk for many medical problems such as heart disease, obesity, diabetes.
And a good night's rest is extremely important, and RLS a lot of times interrupts that night's sleep. Tell us exactly, sort of broken down bit by bit, what exactly is RLS?
Well, RLS, or restless leg syndrome, is a neurologic sensory and motor disorder that causes patients to experience these really uncomfortable sensations in their legs associated with this irresistible urge to move their legs. Now, it occurs at rest, and the only way the patients can relieve these symptoms is by either rubbing their legs, moving their legs, or getting out of bed and walking. And since RLS also is worse at bedtime, these patients can suffer a lot of sleep disruption, and RLS gets worse over many years, so these patients will experience years of sleep deprivation. And
with sleep deprivation, the patient gets up, they're a little bit irritable, I'm sure, and trying to treat this is extremely important, or exactly treating this is very important. How do we treat RLS, and does it vary with ages?
Yep. Well, it depends on the age always, but until recently, the only options we had were medication treatment. And the issue with the medications is medications can cause side effects, and they're not always effective. So it's great that we have a new alternative treatment in Relaxis, which is actually the first non-medication or non-drug treatment that's been approved to treat restless leg syndrome.
And what does that do? Now, this new drug that's out, Relaxis, that you're just talking about, are there any side effects that are involved? And what does it goes in the body, what does it go and sort of attack or take care of to relax the leg during sleeping or when someone is just relaxed?
Okay. Well, the Relaxis is actually not a medication. This is the first non-drug, or it's a device. It's just a pad that you can see. The patient places it under their legs, and this pad provides an adjustment. And what the patient does is when they experience an attack of restless legs, they just push the button, turns the pad on for 30 minutes, and this provides relief from their symptoms so the patients don't have to rub their legs or get out of bed and walk, and enables them to stay in bed and sleep. Mm-hmm. And this has been proven to be effective for restless legs by two studies that the FDA used to approve it for treating and improving sleep in restless leg patients.
I'm definitely going to be checking that out real soon. Doctor, how can people get a little bit more information about this?
Well, the first thing people should do is speak to their own doctor about their restless leg symptoms and discuss whether the Relaxis vibration pad is an appropriate treatment for their RLS. And they can also get more information by going to the company's website at myrelaxis.com, and they can even do a self-assessment test that may help them decide whether it's appropriate for them.
Doctor, we appreciate the knowledge, the expertise, sharing with our viewers as well, and we appreciate everything you're doing to help those with RLS. Thank you so much and have a great day.
Oh, thank you. Bye-bye.
And we've got more after the break, so stay with us.